Going inside the issues of our community, this is Local 12 Newsmakers.
Last year, people became aware of the dangers of toys decorated with paint with high lead content. But more persistent problems exist in the existence of lead paint in older homes, especially poorly maintained homes in inner cities with flaking lead-based paints that were used before they were banned in 1978. In 2006, Council committed the City of Cincinnati to determining the scope of the problem, treating infected children, and taking action to force landlords to either fix the problems or to shut down contaminated properties. Good morning and welcome to Local 12 Newsmakers. In 2008, the City of Cincinnati was one of 8 Ohio cities to receive federal funds to speed up the elimination of lead poisoning health hazards, which is particularly extreme for children under 6. Despite the city's commitment and federal funding, the Cincinnati Enquirer has reported that lead poisoning remains a persistent problem. That report caused council members to question the effectiveness of the health department bureaucracy and in some cases to raise questions whether the autonomous Board of Health ought to continue in that condition. To discuss the status of the lead effort and the future of the Board of Health, I am joined this morning by Dr. Stephen Wilson, the chair of the Cincinnati Board of Health, and Dr. Lynette Collins, a member of the Board of Health and a former chair of the board. Welcome to Newsmakers.
Thank you.
Just to begin, what is your feeling about where we stand with the lead question itself, the specifics of the lead question? Let's start there. Do you think the Board of Health and the City of Cincinnati, are we making progress?
I would certainly think that we're making progress. As part of my daytime job, I work at the Cincinnati Children's Hospital Lead Poisoning Clinic. And we see lead-poisoned children from across the region, from northern Kentucky, from Butler County, from Claremont County, and other surrounding areas. One thing that we've noticed is when we look at the data for the number of children that are lead poisoned, which the state defines as having a lead level greater than 10 micrograms per deciliter, we're seeing that we've seen a steady decline. And for the city of Cincinnati, I believe out of all the lead tests that we've done, about 1.8% of those exceed the level of concern.
We have a couple of graphs here that we can take a look at. If we can take a look at the very first one, let's just start there. Let's just run through these, and either of you can comment as we go along, because this helps people to visualize it. So here are the elevated lead levels over a period of time from 1999 to 2007, and this is the city of Cincinnati, right?
That is correct.
And so a pretty dramatic fall, 1.8% today in terms of children who are tested. Is that what that's saying?
That's what that's saying, that out of all the lead tests that have been done out of the Cincinnati region, and they're subsequently reported to the state, 1.8% of those fall above that 10 microgram per deciliter threshold.
Is there anything else going on here that could help explain that decline other than enforcement and the programs that exist?
I think raising awareness. I know the Cincinnati Health Department runs the Southwest Regional Resource Center, which actually sends out a nurse educator to 27 county region to educate providers, also individuals and
yeah, okay, all sorts of. Dr. Collins, let's take a look at another one of these graphs. This is the one that shows how Cincinnati and the number of children being tested in Cincinnati and other cities. It's hard to read this, but Cincinnati is the second city, second only behind Cleveland, and both Cleveland and Cincinnati are way ahead of any of the other metropolitan areas. Now, how do you explain that? I mean, do you explain that because we're more aggressive? Do you explain that because we have more funding? How do you explain that?
I would explain it more so than our leadership in making sure that we take care of the health of the citizens of Cincinnati. I also wanted to talk a little bit about the slide before and a personal experience on why I became active on this board is my son and myself was a part of that statistic, having lived in a very upscale neighborhood with a Victorian apartment in which my son at the time of his birth had an elevated lead level at that time. And being a new mom, I had no idea on resources or where to go or who to contact. And I contacted the Cincinnati Health Department, and they were very active in making
you're
sure.
saying that your son was born with an elevated?
No, he wasn't born,
Well,
but
okay.
because of where we lived
Okay.
in that Victorian apartment, which is now actually it was declared unlivable and has been abated actually since then, and he's 5 now. But that was my introduction to the Cincinnati Health Department services and how they really helped me and streamlined me to get some services being relocated and whatnot. So when I think about lead, it's a very personal issue for me, and how I know that we are very aggressive at the Cincinnati Health Department, making sure that we educate new mothers and continue.
Well, given this image that the department is aggressive, responsive in your case, there is also this image out there that nothing has changed, that the department is fumbling with this problem and not moving ahead aggressively. How do you put, that's the charge, how do you put those two things together?
Well, I can say, since I've been on the board, I've seen great change in what the department is doing as far as policies in addressing lead poisoning. One of the things under Lynetta's leadership when she was chairman, they actually had the health department to lower the action level of concern. Statewide, usually health departments won't go out and investigate a home until the lead level exceeds 10.
Okay.
Now, we've actually lowered that level to 5. I think we were the first in the country to do that, maybe a handful of other cities that do that. So that we're actually being more proactive in going out and identifying children who may have just a marginal elevation in their lead levels, identifying the homes, and then actually going back and trying to move them into a safer environment.
So if a child is tested and the lead levels are above 5, and then whatever any that means, it doesn't make any difference, but they're at a dangerous level. Is that when the department then goes and says, where do you live, and then goes and inspects that home? Is that how this happens?
That
Yes.
is how it happens, yes. So if it's between that 5 to 9 range, we have a group of nurses who will actually go out and educate the family members and then do a visual inspection of the home.
Here's an issue though. What if there's no child living in a particular apartment or building, or if there's children living in that building but they're not tested? How does the health department, try to systematically shut down places that or take action, remedial action? What about that? Does it all depend on the parents getting the child tested?
I think it also depends on educating the parent. As a school leader and a past, educator in the school, science and health teacher, I find that working with your parents, that's why we have a school health nurse program, and we're really educating our parents, low income or not, to say, we're doing these particular screenings here at your school, but I'm kind of seeing some signs and I'm looking at your address. Why don't you go forth and get some lead testing? It's working with the parents, also a collaborative effort in the school system.
So some of this testing is done at schools. It's not, you sort of do group testing as opposed to waiting for individual parents to bring their children in?
I'm not particularly testing in schools, more so than you have a certain set of health issues, and why don't you follow up, and while you're there
begin
because
to
of the
observe
ages,
it.
exactly, why don't you go forth and get lead tested?
And there's a lot of raising awareness amongst the public too. I know the health department has run a video called Jimmy's Getting Better, which chronicles the experience of a young man who was not tested and showed various missed opportunities, and how this eventually led to some of the mental problems that he experienced. So I think raising awareness by going out to the community, putting things on videos and running some of those videos on TV, and actually with our Southwest Regional Resource Center going out and talking to providers and encouraging providers to test.
One of the issues here though is that a number of years ago there were X number of homes or living units that had been identified as being dangerous. The health department responds, begins to remediate some of those or shut some of them down, but then new ones appear.
Correct.
So is this just what we're going to be faced with for a long, long time, of sort of constantly sort of fluctuating at a certain level?
Well, I think one of the problems we have is this is an older city, and when some studies have been done, they found that roughly 93% of the homes in this city were built before 1978. That would put them at risk for having lead-based paint. Now, as long as the lead-based paint is intact, it's probably safe for a person to reside in.
Intact can mean that it's not flaking off.
It's not flaking off.
And it's not turning to dust,
Yeah.
which may mean that it's been painted over and contained. Is that
That's correct.
correct?
Contained and stabilized.
Okay.
And there are a number of people that live in homes with 93% of the homes being built before 78. They live in those homes that have stabilized or contained paint, and they can live there safely. The problem arises when family members live in homes where, particularly around the windowsills, you notice chipping paint, around door jambs and other areas where there's a lot of friction. You start to see deterioration of the paint, and then you have lead dust, which actually accumulates on the floor, and unfortunately the children are able to put that in their mouths through hand-to-mouth behaviors.
I want to take a look because the nature of this show, and maybe it's my personality, I'm particularly interested in structures of government and how they work. I want to take a look back a little over a year ago about another issue that emerged. Let's take a look at this with nursing homes. Last year, inspectors raided a number of local nursing homes, exposing terrible living and health care conditions.
Things like the tile around the tubs is all falling down, toilets that don't flush, electrical fixtures with no covers, and just about every kind of violation you can imagine. And throughout, we're going room to room, and each room has problems.
The real issue here, as I understood this whole development, was that it was the state who came in and sort of identified this, that the city health department had missed these issues and in fact had given, at least as the owner wants to describe them, glowing reports up until that point, which again raises the question of the effectiveness of the department.
Well, from the reports that we've received as being on the board, the city did go in and inspect those particular units and did cite them. However, there is a process that you have to go through, which we went through to have administrative warrants and then actually to revoke the license. One of the issues we ran into was I believe it was in September, we actually issued a revocation of the license, but since we were stripped of our governing powers over the nursing homes, the nursing home was able to appeal that, and now there's still residents living there.
So, did the state have the ability to come in and do things that you did not have the ability to do?
To my knowledge, no.
No, I was going to answer no.
No.
I was going to answer.
So as a board member, when you saw that situation with the state coming in, what was your reaction to the fact that another agency's coming in and having to take that action and really turning it into a major issue in the community?
Well, my first reaction was, it's good to have collaboration, if I might speak, honestly, because Dr. Noble Maseru and all of the senior staff at the health department, they always keep us informed. And if you, being a historian, that you are, we've had many difficulties with the waste transfer stations and different votes of that nature, where we have tried to implement our governing authority, and thus because of different court actions and things of that nature, our hands and wrists are still tied in terms of what to do. So learning about we're restricted in this area, it's a little difficult to swallow, but knowing that we have a collaborative effort with the state makes me feel a little bit at peace.
But was it a collaborative effort at the time that raid took place?
It had the appearance as the health department is not doing this job, let's come in and be the hero that swoop down and do what they're not doing. However, people didn't know behind the scenes the process of filing, the contempt and filing the revocation, filing all of those processes, and basically not what even though we would do our process that we're supposed to do, the timing of the issues and how they fail. Yeah. You know what I'm saying? So,
I mean, I think there's a thought that process that someone can come in and do an inspection, and if they find something wrong, immediately they can shut them down. And unfortunately, the way the laws are written, we can't do that with nursing homes. There's a process you have to go through.
No, I understand there's a process, but I think it goes beyond the question of the process. The question is, was the city health department aware of the same issues, and even though they were aware of them and couldn't do anything, they couldn't come down and shut it down immediately, they had to go through a process. Was the health department as disturbed as in an appropriate way to the disturbing conditions there?
I think, from my understanding in talking with the nurses who've done the inspection, there seemed to be a significant amount of deterioration from the time that we had done our inspection to the time that they had the raids. Again, they were cited on a number of violations, and we were going through the process to try and give them the administrative hearings.
I want to, in our last minute or so here, I want to raise this issue that Councilman Birding has raised, which is that this autonomous board, and there's other autonomous boards. There's the park board, there's also the Recreation Commission, there's these autonomous boards, but Councilman Birding has said, in the case of the health department, he hasn't made a global statement, this shouldn't exist. The the volunteer nature of the board means that as board members you don't have enough time to really devote to this, and consequently it should be brought directly under the city manager. What's your reaction to that?
Well, my reaction to that, first of all, is that the city has tremendous oversight over the health department, first by their budget. They actually control the budget that the health department receives, thus setting the policies that the health department will implement. In addition, they actually vote on us. The mayor appoints us, but then we have to be voted on by city council members. So if they have concerns about our performance, they can actually go to the mayor and actually have us to be resign or removed, because we serve at the pleasure of the mayor. In addition, the health department goes down on a routine basis and presents at the Health, Education, and Recreation Committee meetings and provides information on different aspects of the health department, whether it be how the clinics are operating, what kind of progress we've made on food service inspections, and many of the entities that reside within the health department. So I think they do have tremendous oversight. What we do is we provide some oversight within the boundaries of the budget that we have.
Before we get a final comment from you, do you feel that's adequate oversight?
Yes.
You do, okay.
And we have to remember, historically, having our health department having a political reign. And if you think back to the 1800s with the milk wars and what actually took place when our health was at the hands of politicians. And we have actually seven doctors that sit on this board in various disciplines, and 2 awesome other professionals in mental health and HIV and AIDS advocacy. And so we are health professionals in one venue or another. And just our work in our employment field, so to speak, just really fuels our our volunteerism on the board.
I want to throw in too, I mean, this politicization of health. This is not just around nursing homes or lead, but in the 1990s and 80s it was around contraception issues and abortion. There's a lot of opportunities for politicization of this whole thing, and that is a balancing question that I think we have to get to.
Absolutely, absolutely. And I think there's a lot of commitment on the board. I think when we had the ice storms in January and February, we didn't cancel we canceled our meeting in January because the city manager had a citywide emergency, but in February, a number of our members faced the ice storm to try and come to the meeting so that they could vote on appropriate things. So I think to question our commitment is probably inappropriate.
Thank you very much for being here. We will continue to follow this both on the structural level and on the specifics of lead and other issues too. Thank you.
Thank you.
Stay tuned. After the break, a newly announced initiative to address the issues faced by not-for-profits in the economic downturn. Welcome back. Large and small not-for-profits face daunting problems in the midst of the current economic downturn. Large government social service agencies like Job and Family Services or large private agencies like Talbot House that depend on government-funded contracts have seen budgets slashed because of government cutbacks. Private agencies with meaningful endowments have lost 25 to 40% of their investments like everybody else, while small agencies dependent on annual fundraising face donors who have reduced means. On the other hand, as more and more people are unemployed, demand for services go up. In the face of this economic storm, the Greater Cincinnati Foundation and the United Way hosted a conference last Monday afternoon. The room was packed with nearly 400 people, I think, from various agencies. At the end of the GCF and United Way made an important announcement. To discuss this initiative, I am joined this morning by Kathy Merchant, the President and CEO of the Greater Cincinnati Foundation, and Barbara Terry, the Vice President for Community Impact with United Way of Greater Cincinnati. Welcome to Newsmakers, and welcome back.
Thank you.
We've spent a number of shows since January 1 on this very topic here on Newsmakers, so I don't want to go over all the details of what I think that people have a sense that this is a very extreme situation, economic storm,
Indeed.
as you put it. Tell us about the initiative that was announced on Monday afternoon at the end of that conference.
Well, for the Greater Cincinnati Foundation, this is actually it's kind of a third round of investing in our community's issues at a higher scale each time as the community's crisis has escalated. Our board committed $1 million in hopes of getting that matched by the community. We are almost there. We have nearly $2 million to put toward enormous issues. So we believe that this is a beginning, not an ending, of what our community needs to do to help people through a tough transition time until we get to the other side of whatever you want to call this, a recession, a borderline depression. It's tough for people, and we're trying to do our bit in partnership with the United Way.
And Barbara, at the United Way, I mean, you are the umbrella agency helping all of these organizations that are out there. Is there a way of sort of registering, documenting the fact that demand is really up? Is there any way that you see that really you can say, yes, this is a tough time for people?
One of the services that United Way provides is what's called 211. And when we think about 211, it's really just dialing 211 into the phone. Just like we dial 911 for emergencies, we dial 211 for information. 24 hours a day, 7 days a week, we have individuals that answer the phone and provide referrals. So if someone needs assistance with rent, needs assistance with utilities, has run out of food, needs diapers, they can call 211 and we will refer them to the appropriate agency. What's interesting to us, over the last 12 months, we've seen a 34% increase in call demand. We have seen increases in requests for very basic needs. There was a 5-day period about a week ago where we received over 3,000 calls, most of those being for energy assistance. So we're just seeing demand go up, and that becomes a wonderful barometer for the community.
Now, a frightening barometer.
Scary,
for the community.
but a way to check.
So need is way up. We can document that. You know, as I tried to set up organizations with endowments, which includes GCF,
Yes, it
by
does.
the way.
Yes, it does.
So this is not the best time for you to be committing more and more money, but it's necessary.
It is absolutely necessary.
And the really important point about this, and I have a little bit of a graphic to cover this, this is a collaboration. It's not just GCF and United Way. There's a lot of different organizations involved. And just describe, and we'll put up some of the names. GCF, $1 million, but we have large foundations and companies like United Way and Macy's and P&G, and small foundations too that a lot of people would never have heard about.
That's
the Young
right.
Family Foundation. How have you brought these people to the table?
You know, I'm glad to tell you that it was not that difficult. First of all, we both have extensive relationships with our colleagues in the philanthropic community, and as soon as our board decided on March 4th that this would be the direction that we would go, we convened a meeting actually before March 4th, assuming that our board would say yes, and just presented the need that Barb has just articulated of what we're seeing in the community, and said, you know, it's one thing to come together and just sort of talk about it, it's yet another to do something. Please come to this table, make an investment together in the community. And so far, and I'll say so far, we have 15 colleagues working with us, and soon, by the end of next week, I think, we should have, no, this week actually, we'll have it up and running, a place on our website where you can contribute by credit card, or you can mail a check, or if you're a donor advisor to the Greater Cincinnati Foundation, and make a contribution to weathering the economic storm, knowing that the foundations and corporations in our community will lead the way on spending it properly.
This was a failure on my part. The website is?
The website is www.greatercincinnatifdn.org.
Or you can always just Google.
Google the Greater Cincinnati Foundation.
Which is what I do all the time.
Absolutely.
On the other side of this, United Way, of course, the campaign will be coming up later this year. It is even more critical and probably more difficult as you go into this campaign to raise the money that you need. What do you think? What do you think is going to be the goal this year, and how do you realistically approach this?
Well, I think there's two things that we need to be careful with. This effort is so important and so critical, but should not be viewed as a substitute for the United Way annual campaign. We need to absolutely appreciate that we need to have an infusion of dollars into the community. So critical for foundations to join together and for United Way to be at the table to infuse the dollars. Then we have the annual campaign that traditionally for us kicks off end of August, ends the end of October. Boy, I think we all wish we had the crystal ball on that. Certainly no time has probably been greater, but we don't have a way to really judge yet.
I'm just about out of time. The good news on that is A.G. Lafley is going to be leading your campaign this year, and it could not be a better person to have behind this. So this is a new initiative. People can take part in it, and it's absolutely essential if we're going to all get through this together.
It's a supplement to the United Way's nearly 100 years worth of steady support for human services.
Thank you very much.
Thank you.
for
You're
what you're doing.
Thank you.
Thank you for making Newsmakers a part of your Sunday morning. Join us again next week for a special report that will come out this week on homelessness policy. Have a good week.